Renee, how are you today?
I'm good. How are you?
I'm good. So my name is Fania. I'm the occupational therapist that's going to be working with you today. So give me a moment while I go wash my hands and then we can get started, right? Okay? All right. So today what we're going to be working on is learning how to do lower body dressing using adaptive devices. Do you have an idea of what those are? Okay, that's fine. What they are is like certain reachers we have, which are these we use, which I'm sure you have seen these before, like on commercials, and some people using them to grab things. Well, we can also use this to put your pants on when you need to when you put them on when you get dressed in the morning, right? Okay. And you can also use them when you're taking the pants off as well. So that's something we're going to use also today to learn how to use it. You use it here to grasp, and you can try it here. And try to get used to it a little. And then as you can notice, there's this little ring here as well that you can use to help pull up the pants as well. Okay? Cool. Yeah. And then also what we're going to use is a walker. Okay? Because I understand that because you had a total hip replacement, your doctor recommends that you do not place any type of pressure on your left leg. So I'm going to make sure to be careful with that. And I see you're keeping on to the hip precautions, which we already know for sure. Do we know what those are as well?
I know one.
Which one is it?
Not raising the leg above like the way, but this one is positioned.
Right, so you can't pass 90 degrees, so we know we can't be doing these or these, none of that, right? So the best way to make sure that we don't break it at all is, which what you're doing now, just leave it extended, and then you can just sit like that. You won't pass 90 degrees, right? And then you're going to be able to put your pants on by leaving your leg like this by using the reacher, okay? And then with this walker, the reason why I have it here is for you, is that way you can use to hold it while you stand. So in that way you don't apply any pressure on that leg as well. All right? So what you're going to do is with it, you're just going to use it like this with your leg extended still, and then you're going to push off from your chair. Always push off from your chair, not from the walker, right? Okay, so we're going to go from here. So it's going to 1, 2, 3, push, and then you just hold on to the walker.
Right.
And then we're going to use the good leg, the right leg, that's not operated on so that we can push up off of it, right? Okay? And then just from here, and then you'll be able to use it to pull up. All right? Okay, great. All right, so a little also want to make sure, for precautions, you said you knew that you didn't want to bring the leg up. You remember that one.
Yeah. All
right, so you also don't want to do is you don't want to torque your leg, so you don't want to turn it in a certain way because you had it posterior, so on your butt mostly. Oops.
Right.
So you had it mostly on your butt. The incision is more on your backside, correct? Okay, so what you don't want to do with the leg is you don't want to do this, right? Because then it'll make everything come back out and you have to get right back in surgery again. We don't want that to happen.
Right.
So you don't want to internally rotate is what we call it, but just don't turn your foot inward.
Right.
Right? Okay. And then another one as well is, let me see, we said don't flex. Oh, we do not want to do this.
Not crossing any legs.
No crossing legs.
Okay.
All right, Renee, so what I'm going to do first is I'm going to take your vital signs to make sure that everything is okay, all right, so that we can move forward in learning how to dress your lower body. Okay? All right, go ahead and pull up your sleeve for me. There we go. Bring it down. And just rest it down here on my knee.
Okay.
right, so you're pretty good for now to go on with treatment.
Okay.
Your vitals show that you're at like 135 or 160. So that's good. Okay? All right, so let's move on.
Okay.
You have your reacher. Do you have your pants with you
Mhm.
that you want to use? Okay. Grab mine. Okay. All right, so first thing, let me also, what you want to do is when you grab your pants, you want to have it here with you, lay it on your leg, just as you did. Have this here, and then you want to also have your walker nearby, ready to go. So what I'm going to do for you is open yours, make sure it's ready, okay? So you don't have to do too much work.
Thanks.
Okay, there you go. So you want to have it to the side for now.
Okay.
Okay, it's going to be close so that we can just pull it and put it right in front of you. It's very light.
Right.
Okay. So I'm going to put this to the side as well. All right, so now we have here, correct? So now with our leg out, ready. Now the first thing first is we want to always dress the affected leg first, and you end with the affected leg. So start with the affected leg, end with the affected leg.
Okay.
And what that means is you're gonna put this pants on first, this leg in first, and then this leg. And when you're taking it off, you start off with this leg, and then you end with this leg.
Oh, okay.
Okay. All right, perfect. So first thing first is what we're gonna do is we're gonna scrunch up the pants leg. Let's put this down here on our hips here. We can do that. And just pants this up. Good job. You got it?
I lost the whole.
All right, so you want to make sure it's the left pants leg as well. Is that the
Right.
left? Let's see if you have your pants backwards there. There we go. It happens sometimes. It's
That's
okay.
a battle. So no, I've seen that sticker before. What's it over there?
Happens to the best of us. All right, perfect. So now what we're going to do is we're going to use the reacher, and we're going to attach the hook here, just like that. You got it? All right, so what you're going to do now is you're going to bring the pants down to the floor, and then you can lift your leg a little bit and insert your foot in. Right. All right, and then you can let it go, and if you need to adjust it around your foot, like so.
Then just grab it.
Just bring it up. And bring it up as much as you can, if that's going to help you do better. There you go. All right, you got it in?
Mm-hmm.
Perfect. So now, what you can do is you can attach this to your walker for now until you need it. Okay. Or do that too. There you go. And then what we can move this leg however, right?
Right.
So we leave this leg extended, and then you can put this foot in. Okay? All right, so now this is where we're going to need to stand up.
Okay.
Okay? Now, remember again, we're not putting any pressure on this affected leg, right?
Right.
Okay. So now what we're going to do is we're going to bring the walker in front of us. You got it?
Mm-hmm.
Okay? So remember what we said? We're going to push off the chair.
Okay.
And then we're going to catch our balance and stand and hold the walker. Okay? So ready? 1, 2, 3, go. There we go. Try to hold on. There we go. And then pull your pants up. Try to hold your leg up. Don't pressure at all. You can use the walker to hold on. You got it?
Mm-hmm.
All right, perfect. So now this is how you put your pants on.
That was easy.
It was. Okay, so now how to take it off is the easier part too. So what you can do is you pull the pants down,
Mm-hmm.
pull all the way down to like your thighs area, your middle thigh, in both sides. You got it?
Mm-hmm.
Okay. So then now what we can do is you can sit, but make sure when you sit to reach back for the chair and then sit. Okay? So go ahead. Good. And then what we can do is, remember what we said to start, we're going to end with the affected leg, right?
Right.
So we can move this up a little bit so it's not in your way. So now, grab your reacher. What you can do is you can push it down to help you assist so you don't break that hip precaution, right? You can.
They got stuck.
Stuck? Up. You can, there you go, shift it a little bit. There we go, good job. And then push it down. And you can move this leg, of course. And then here, you push down. Some more. And try not to break hip precaution. And then you're done. Good job, Renee.
Thank you. That's pretty easy.
Very easy. So now, of course, whenever you're done, you can just fold your pants up or put it to the side whenever you're ready for another day. Put this back on.
Thank you.
All right. So do you have any questions?
No.
No? Do I need to go over anything?
Maybe the precautions over one more time.
The precautions? All right, perfect. So remember again, we don't want to do any of this. We don't want to, you can bend the knee sometimes if it's getting like a little irritated to stay like this. You can't, if you do bend it, but lean backwards. Lean back like this. Okay? So you don't want to sit close back to the chair like this and sit like this because there's a greater chance of you end up sitting straight up like that, right? So if you do want to sit with bend your knee a little bit, sometimes just lean back like this.
Okay.
Okay? And another thing as well, we don't want to do this.
Right.
Right? And then we also don't want to cross our legs.
Right. Okay. That was the one I was forgetting.
Never cross the legs, and you don't want to do this either. Okay? None of anything that has this foot to come on top of this one. Totally out of the question. All right? And I know your doctor also said for now, no weight on your leg.
Right.
So try to stay off of it.
Okay.
Don't forget, don't try to put any pressure on it.
Okay.
All right? All right, Renee, so what I'm going to do is I'm going to take your vital signs to make sure that everything is okay.
Okay.
Okay? All right. Go ahead and pull up your sleeve for me. There we go. Okay. And bring it down. And just rest it down here on my knee.
Okay.
All right. All right, so you're pretty good for now to go on with treatment.
Okay.
Your vitals show that you were at like 135 or 160. So that's good. Okay? All right, so let's move on.
Okay.
All right, so if you have any questions, feel free to contact me. Let me get you a handout that also states the same thing we went over today. So that when you go home with it, you don't forget anything.
Okay.
And it also has the precautions on there because I know you're going to forget.
Thank you.
All right, so give me one moment while I get that for you. Okay. All right, and here it is. Okay? All right, it's all on there for you. Step
Pictures
one.
too.
Yeah. So if you can see, step one shows that you have to remember the precautions, and then you're going to also prepare the leg, right? And then step two is you use the reacher to attach it to the pant hook, the leg, right? After we scrunched it up. And then step three is we put it onto our leg,
Right.
And then we try to put our foot into it without bending our legs, right?
Yeah, I see it here.
And then step 4, we pull it up.
Okay.
All right?
Perfect.
Okay. And then it also has the same directions, also as to take it off. So if you read over it, let me know if you see anything that you don't understand.
The pictures kind of show it really well.
All right, perfect.
Thank you.
All right, Renee. So next session, we will work on also putting our shoes on and doing other things as well. Okay?
Perfect.
All right, so see you next time.